Introduction. Ladies and gentlemen, esteemed medical students, welcome to today's lecture on the fascinating field of clinical mycology. In this comprehensive overview, we will delve into the intricate world of fungal morphology and taxonomy, mechanisms of fungal pathogenesis, laboratory techniques for diagnosing fungal infections, therapeutic approaches, and much more. As future healthcare professionals, it is essential to grasp the complexities of fungal infections and their implications on human health. So, without further ado, let us embark on this enlightening journey. Fungi are important microorganisms that come in different forms. Knowing their appearance and classification is important for identifying medically significant species. Fungi can be single-celled yeasts or multi-celled molds, and some can change their appearance. Fungi are classified into different groups based on genetics and characteristics. Understanding these classifications helps with identifying fungi and treating infections. In clinical mycology, fungi employ sophisticated mechanisms to establish successful infections. Adherence to host tissues is mediated by fungal adhesins that recognize host receptors. Fungi manipulate host cell signaling to facilitate invasion. Host defenses include innate immune cells recognizing fungal-associated molecular patterns, PAMPs, through pattern recognition receptors, PRRs. This initiates an inflammatory response and recruits additional immune cells. Adaptive immune responses involving T cells and antibodies also control fungal infections. The accurate laboratory diagnosis of fungal infections relies on proper specimen collection and transportation. Microscopic examination techniques, including co-wet mount and staining, help visualize fungal elements. Culture on specialized media, supplemented with nutrients or antifungal agents, aids in isolating and identifying the pathogen. Additional identification methods include colony morphology, biochemical tests, and molecular techniques. In the section on antifungal therapeutics, we will discuss the mechanisms of action of various antifungal drugs, such as azoles, polyans, and echinocandins. Additionally, we will explore the factors that contribute to the development of drug resistance and the importance of susceptibility testing in determining appropriate treatment options. This section discusses the diagnosis and treatment approaches for superficial and cutaneous fungal infections, including dermatophytosis, candidiasis, and pityriasis versicolor. Diagnosis involves clinical signs, symptoms, and laboratory findings, while treatment often includes topical or oral antifungal agents. Systemic fungal infections pose significant challenges due to their potential for dissemination and serious morbidity and mortality. These infections mainly affect immunocompromised individuals, including those with HIV/AIDS, organ transplant recipients, or patients on immunosuppressive therapy. Invasive candidiasis, invasive aspergillosis, cryptococcosis, and mucormycosis are examples of life-threatening systemic fungal infections. Diagnosis relies on a combination of clinical evaluation, laboratory tests, and radiological imaging. Early initiation of systemic antifungal therapy is critical, often involving broad-spectrum azoles or echinocandins, alongside management of the underlying immune dysfunction. Immunocompromised patients, such as those with HIV/AIDS, malignancies, or undergoing chemotherapy, are at higher risk for opportunistic fungal infections. The compromised immune system allows fungal pathogens to proliferate and invade host tissues more readily. Opportunistic fungal infections commonly encountered in these patients include pneumocystis jirovecii pneumonia, PCP, invasive aspergillosis, and disseminated candidiasis. Effective management depends on timely diagnosis and institution of appropriate antifungal therapy, often combining anti-infective agents and immune reconstitution strategies. Co-infections with multiple fungal pathogens markedly complicate the diagnosis and treatment of HIV/AIDS patients. Common co-infections in this population include cryptococcal meningitis, pulmonary tuberculosis, and invasive candidiasis. Diagnostic approaches rely on a combination of laboratory tests, including cerebrospinal fluid examination, blood cultures, and radiological imaging. Effective treatment entails antifungal therapy tailored to the specific pathogens involved, alongside management of the underlying HIV infection and other coexisting conditions. Antifungal susceptibility testing plays a crucial role in guiding appropriate treatment decisions and identifying emerging drug resistance. Testing methods vary depending on the antifungal class and fungal species of interest. Standardized methods, such as broth microdilution or disc diffusion, assess the minimal inhibitory concentration, MIC, required to inhibit fungal growth. Alternative techniques, including EDIST and agar dilution, provide essential information on drug efficacy. Interpretive breakpoints established by regulatory agencies help classify strains as susceptible, intermediate, or resistant, enabling clinicians to select the most appropriate therapeutic interventions. The immune system responds to fungal infections through various mechanisms. Recognition of fungal components by immune receptors triggers an immune response involving engulfment of fungi by immune cells, as well as the activation of specific immune memory and antibody production. This understanding helps in developing treatments and vaccines. Certain fungi produce mycotoxins, which can contaminate food and harm human health. These mycotoxins have various effects on the body, such as liver and kidney damage, neurological effects, and immunosuppression. Regulatory agencies monitor mycotoxin levels in food to protect public health. The diagnosis of emerging fungal infections is challenging due to new pathogens appearing or previously unrecognized ones. Molecular techniques like next-generation sequencing and MALDI-TOF can quickly and accurately identify these rare or cryptic species. Immunological and serological markers are also being explored for improved detection. In conclusion, clinical mycology is complex and requires multiple disciplines. We have studied fungal morphology, how it interacts with hosts, diagnostics, therapies, and emerging issues. Knowing these concepts will help you handle fungal infections and enhance patient care.